Dr. Reverend Yvette Noble-Bloomfield is a minister of religion ordained for 39 years, having served in congregational pastoral ministry for 25 years as the director of the Bethesda Counseling Center for over 4 years and serving in church administration for 10 years. Dr. Noble-Bloomfield has a clear understanding and appreciation for the needs and challenges of humanity, the ministry and mission of the church, and the importance of cultivating healthy and restorative relationships in order to enhance the well-being of individuals. She strives to be faithful, disciplined, and competent in order to respond to the current challenges individuals and the society encounters in the area of healthcare and healing. Ladies and gentlemen, let's welcome Reverend Dr. Yvette Noble-Bloomfield.
Good morning, and I thank the planners for this opportunity to speak at this very critical healthcare conference. When I look in the room today, I see dedicated administrators, clinicians, nurses, support staff, stakeholders, who together ensure the integrity of the healthcare ecosystem. Each day and under every circumstance, as dedicated workers, you place the patient at the center of the ecosystem. To sustain the highest integrity so that the patient receives the best possible care, the realization is that trust must be integrated at every level of the ecosystem. The truth is that the system can only work for the patient if, as healthcare providers, we trust each other. I know that this presentation has a lot of tentacles, and I'm going to try and contain the tentacles, because the truth is that if we do not trust each other as professionals, if we do not trust each other as service providers, the ecosystem, although it works, will not work at an optimal level. We are human beings, and the ability to trust is a strong emotional disposition. In daily interactions, if we do not trust each other, the relationships will deteriorate and the life of the patient is at stake. I'm not going to cite any particular cases of distrust, but I ask you to just think, if in the theater the wrong instrument is used because someone did not carry out their due diligence, what is the effect on the person being operated on? So, that was the preamble, because I want then to reflect with you. The healthcare ecosystem refers to a system in which patients, healthcare providers, healthcare policymakers, and administration participate in the health outputs. The underlying thesis for this presentation is that for the healthcare ecosystem to function optimally, individuals and organizations must be trustworthy. Trust, and I'm going to give a brief definition of trust, is the willingness of a party to be vulnerable to the actions of another party based on the expectation that the other will perform a particular action important to the truster. And that is from Mayer. So I've just spoken about the thesis of this and then the definition of trust, commonly defined as the willingness of a party to be vulnerable to the actions of another party based on the expectation that the other will perform a particular action important to the truster. And the quote is from Mayer. Trust, human beings must rely on each other in every sphere of activity, thus making trust paramount. For social interaction to be beneficial to all, it is imperative that every person is trustworthy. Trustworthiness of each participant is intrinsic to the healthcare ecosystem. But there's a spiritual dimension to trust. Within the realm of spirituality, trust is the willingness to put aside one's own understanding and instead lean on divine wisdom and guidance. And you'll see where I'm going in a minute with this. The person guided by divine wisdom searches for meaning, purpose, and truth in life. The person lives and abides by beliefs and values which inform every dimension of life. In so doing, that person can say, I must trust myself first. So in all that you do as healthcare providers, let us make sure that we trust ourselves first. In order to trust and to be trustworthy, I've created what I'm calling a personal litmus test. We must have a moral compass, a guide, a guardrail. We must have something that sets a standard for who we are. We must have the cardinal values of integrity and kindness as healthcare workers. We must have emotional intelligence. And I just pause there because I find that even though we are professionals, there are times when we are not emotionally intelligent. And so for the slightest reason, some of us are not able to control ourselves. And if we keep on doing that, persons are going to find it difficult to trust who we are. So I encourage all of us, starting with myself, to make sure that there's always a moment when we can check ourselves, when we can apply intelligence rather than allow an emotional experience to devastate us. Wisdom. And I want to attribute the wisdom from a divine source. And so I must ask myself, can I trust myself first? And then, can I trust you? Trust in others is manifested in the willingness to be vulnerable to the words, promises, and actions of another person. I can only be vulnerable to someone if I know that someone can be vulnerable with me. And so we come back to, I must trust myself first. I must know I am trustworthy. Part of the research that I did came out of this book, The Speed of Trust by Stephen Covey, and I would recommend it as a good read. It's almost 20 years, 2006, but it provides for us some critical understanding of how we trust others. And there's this quote I'm using: trust is the highest form of motivation. It brings out the best in people. For the healthcare ecosystem to work, for people to be motivated on the job, for professionals to keep their levels of integrity going, we must have trust. And I'm going to develop this a little bit more because there has to be trust from the level of the Ministry of Health, the Minister of Health, the policymakers, the CEO. Or we must trust you in the same way you are trusting us to deliver health care to the people of the Cayman Islands. Yeah, don't clap. I want to survive, right? But it is true. We have to trust from every level. Without trust, relationships have no sustainability. The correct elements must coincide for trust to be initiated and developed. And I've used the letters as an acronym, and for trust, there must be truthfulness, there must be reliability, ubiquity, and I just want to spend a moment on ubiquity. At every level, from the person who is cleaning the floor on the ward, to this neurosurgeon, And I don't know if Dr. Cook is here, but to you and your team for the latest surgery, the craniology that you perform, from the cleaner to the neurosurgeon to the gynecologist, everybody, every layer of the healthcare system must have trust, and that is why I use the word ubiquity. The pharmacist, the lab, radiology, emergency, and I could go on to list as many of the departments at HSA, and those departments are replicated in the other private hospitals. If there is no trust, as you pass the patient along the system, the patient is going to suffer. So you and I must be able to trust each other from the very beginning. And then I also put spirituality in it, because your moral compass, your connection with the divine, makes you trustworthy even when no one is looking. We don't slack off. We don't do the wrong thing. But we always ensure that there is justice in what we are doing. And so I call all of that our spiritual engagement in this matter of trust. And then there's transparency. From the senior management, the policymakers, the dietitian, we must be transparent in what we do. People must understand that we are working in the interest of the patient, and at the same time, we are being trustworthy. So that's my little acronym for trust. Truthfulness, reliability, ubiquity, spirituality, and transparency. Trust in others. As healthcare providers, and I'm going to quote here from the standards of performance, as healthcare providers, we are given the opportunity to engender trust in our community. It is through the display of genuine compassion and concern that we're able to provide adequate and appropriate care to those who seek our help in achieving optimal health. And that's the HSA's service excellence standards of performance. And I'm sure that the private sector hospitals, you have your standard of performance. And the expectation is that the patient will benefit. The interconnection of individuals in the various spheres of the healthcare ecosystem requires that relationships must be grounded in trust. For the interpersonal and professional relationships to be beneficial to the healthcare ecosystem, trust is not only essential, but supreme. Without trust, the relationships that are integral to the healthcare ecosystem can become dysfunctional. When trust is absent, the healthcare delivery mechanism becomes disrupted. What are the consequences of a trust deficit? Loss of life. When it is your family member that dies because the system did not work, it becomes a very critical moment for you. Litigation. When your action caused the hospital to face a devastating litigation against it, we have a problem. It may lead to your loss of a job. It may lead to public embarrassment. And the problem is, all of that lead to public distrust in the healthcare system. When one person has this particular experience and it is spread abroad, it is the entire healthcare system that is branded. And I speak from the church as an industry. When one pastor does one thing, it is the entire ecosystem of the church that becomes questionable. The same thing happens in the healthcare ecosystem. So there is this need for trust to safeguard the patient's trust in the strive for excellence. Patients must trust the clinicians and all staff at the public health facility. Patients' trust in medical professionals is fundamental to the sustainability of the ecosystem. Just let two patients decide that they do not trust the doctors at a particular institution, and it's gone. And so at every step I'm saying, We must be trustworthy, and people must continue to say that the brand, and it's not just the beauty of the brand, it's the integrity of the brand that must be maintained. Relationships of trust, the staff, each other, the administration and the staff, the administration and the external stakeholders. We just spoke about the collaboration by the panelists who were here. If at any stage, any one of them decides that the other is not trustworthy, the collaborative effort goes through the window. So we have to trust each other. Can I trust? Clinicians need to trust each other's professional work. All staff need to trust each other's professionalism and integrity. The established policies and protocols need to be trusted. The capacity of colleagues to abide by the established policies and protocols, because you can have policies and protocols, but if your colleagues are not willing to abide by them, there is a problem. And the willingness to abide by the protocols when there is a crisis. So even in the crisis, we must maintain what needs to happen. Loyalty and confidentiality of colleagues and managers. Lord help me. It seems as if we have a confidentiality issue in some of our healthcare institutions. Full stop, Yvette. Trust has been broken. Has trust been broken? We've all felt offended or taken advantage of by how others have treated us. This can cause people not to trust each other. These feelings can adversely affect the relationship when this occurs in the work environment. What happens when there is a distrust or a trust deficit in the workplace? Lack of respect, insufficient support, unkept promise, lack of confidentiality, overlay of threat or punitive action, no one listens to the concerns, lack of credit or recognition for going above and beyond duty. And the truth is that these concerns are hardly raised where they need to be raised. But we say them under the covers and under quiet. And it disturbs our soul. We continue to do our work, but we're hurting. And when that happens, we're not able to trust the system. And the system has got to be careful that we do not become unreliable. How do we develop this culture of trust? The culture of trust must encompass the wider sphere so that there is trust in the overall healthcare system. Each stakeholder must trust the judgment and credibility of the other. And I reiterate something that I've said. If we are to deliver the best healthcare to the people of the Cayman Islands, from the policymakers to the janitor, must work together in order for the patient, the public, to be healed. We can't have any breaks in the system. Trust must be there at all times. And I'm wrapping up. Developing the culture of trust, and I'm using Paul Zak, a renowned researcher and author of The Trust Factor. He has evidence that people who trust their employer and co-workers are healthier than those who don't. And the statistics that he offers us, in over 2 decades of research, Zach found that compared with employees at low-trust companies, people who work in high-trust environments have 74% less stress, 106% more energy at work, 29% more life satisfaction, and 40% less burnout. So really, if we are to have healthcare workers operating at their best, we must develop a culture of trust. It is essential that in each unit, each section, each department, that there is a trust relationship. The nurse manager must be able to trust the nurses on her ward that they are carrying out the work to the best of their ability. They must also be able to trust the nurse manager that she will look out for their best interest. And I'm just using the nurse manager as an example. As the trust linkages are made and sustained, the entire healthcare ecosystem will develop a culture of trust. Healthcare providers must trust each other's integrity and capacity to ensure that health and safety of the population that utilizes the healthcare ecosystem. Thank you.
Thank you very much for that talk, Dr. Bloomfield. I wanted to ask you to address one other thing when it comes to trust, and that is having a just culture. Not just in one organization involved, but between the players. Okay. Could you comment on that, please? Thank you.
In this and many societies, there is a problem with how we treat persons who are different, persons who are challenged. And when we talk about a just culture, we're saying that everybody must be recognized for who they are and be able to receive from us the same level of care, the same level of concern. No one should be marginalized or set aside because they are not equal to other persons. That's how I would say. And we have to ensure that as individuals and as a system, that all participate equally with a sense that this is how we function when it is just for everybody.
Dr. Bloomfield, thank you very much for that presentation. I'm a little biased because you're my friend and I like you, right? But we can drop the mic on this one. But there's an article that was released in 2022, which is about building individual and organizational wellness through effective followership. And the very first thing it states in the abstract is burnout is widespread across the healthcare industry. And when you think of leadership and followership, what a lot of people tend to forget, it's a mutual thing. It's you and I subscribe to the same goals and objectives. And so even though you may get paid a little bit more than I do because you're the leader and I'm the follower, in any context, one might be a follower rather than the leader in that context. It's to understand and realize that, you know, we both subscribe to the same thing and have an understanding amongst us. And what I found interesting based on what your last statement is in this, it says, and I find it quite interesting, is there are many systemic organizational factors external to the follower-leader relationship that contribute to burnout, but they are likely better fought or endured with a united front. So thank you again for your presentation.
Thank you, Dr. Wilkes.
So we'd like to say thank you to Reverend Dr. Noble-Bloomfield. Let's give it up for her for this presentation.